gotta go to Ross.
Of course, it is a beautiful sunny day. The birds are singing, the flowers are blooming. We're riding on our cars because of all the dirt. It's not dirt, it's pollen.
That green film. Many of us are dealing with itchy and runny noses, and even worse than that in some cases. So today, to help us get to the bottom of allergy season, we have Medical Director of SignatureCare Emergency Center at the Montrose location, Dr. Samar Yusuf, and Trey, who is a patient there. Hi, guys.
Hi.
Hey, thanks so much for coming in.
So, and Trey, we're going to get to your symptoms in just a moment. But, Doctor, I want to start with you talking about pollen because it's really an irritant for a lot of us. But for many people, it becomes way more serious, and they land in the ER.
Yeah, right now, you have tree pollen, and it's starting to become grass pollen starting to come out too. So it's really a tough time of the year for people who have allergies, and they can get anywhere from mild to moderate reactions, such as just the sniffles, like you talked about. But then some people can have hives, swollen eyes, trouble breathing, complete congestion. So it varies from person to person, but.
Would you say that really everybody is kind of affected during this season? Because I haven't been diagnosed with any allergies per se, but I find myself with the watery eyes, the itchy throat, even though I don't have a problem with it throughout the year. Would you say it's probably everybody's susceptible to something like this?
Yeah, a lot of people are. And basically, if you're having those symptoms, you probably are susceptible to something. Whether, again, like we said, there's multiple kinds of allergies that are going on right now, multiple different kinds of pollen. So for you, it might be just this time of the year. For some people, it's in the summer. For some people, it's in the fall.
Well, and especially for visitors who come to Houston, it's like, welcome to Houston. And then all of a sudden they can't breathe. You guys are seeing a lot of out-of-towners in the ER, right?
Yeah, definitely. We're seeing a lot of out-of-towners that are having more severe reactions than they typically deal with back at home. Again, they're dealing with different allergens. And again, the humidity also here promotes mold, which could be something new for somebody who's not from a humid climate.
Mm-hmm. And as we're seeing, too, it's not uncommon to head to the ER, SignatureCare, to get you healed and feeling a lot better.
Courtney's there every week.
I've been there. My whole family has, for sure. But this is where I want to bring in Trey. He's 10 years old. You've dealt with asthma and allergies since you were 10 months old. And talk to us about heading over to the doctor and seeing, having them treat you for the allergies. It's a tough kind of part of the year for you, isn't it?
Yeah, I have allergies, so that's one of the hard parts about trying to get through the spring. It's one of the allergenic seasons.
Okay, at 10 years old, though, going to the doctor is not the favorite thing for a lot of people. But I understand it's a little different there at SignatureCare ER. They let you play with an iPad?
Yeah, they give you like an iPad and a warm blanket.
A warm blanket?
Yes, hot blankets.
What?
It's like a spa. It is, absolutely.
Very nice.
And that's where you basically receive your breathing treatments, and they keep you busy and occupied, kind of going through what you've got to go through to make sure that you're breathing healthy.
They make the time fly by fast.
Dr. Yusuf, if someone is experiencing these symptoms, how do they know when it's time to actually go to the ER and do something about it?
Well, I would assume they've tried some over-the-counter medications, allergy medications, but if those aren't helping, that's one reason to come in. The other thing would be if, like Trey, and you have asthma, so a lot of people start having trouble breathing. The pollen's triggering their asthma, so that's definitely a sign of that you should come get checked out.
Well, because that can, if someone's experiencing an extreme asthma attack, that can sort of constrict the airway and prevent full breaths, right?
Yeah, and again, asthma has a range where it's just shortness of breath to potentially life-threatening. So it's something that you do want to get taken care of quickly.
When should we see a relief in this? It's usually about 2 to 3 weeks, right, that we're seeing kind of the peak of the pollen season?
Yeah, so right now is a peak. Unfortunately, in Houston, you will have some stuff go through the summer and then ragweed in the fall. Like I said, for different people, it will, different times of the year can trigger, but right now we are at the peak. So once the showers come, they should help alleviate some of that too.
Those are coming this week too, and we're looking at on the screen here some of the different levels of allergies. So basically from mild to severe, what the symptoms would be.
And Dr. Yusuf, how long until people can expect to see results from your treatment? Like if someone comes to SignatureCare ER, I have a drawer full of allergy medication at home, like the giant bottles from Costco. And you see a lot of people who they try one after the next, it doesn't work. When they come to see you, how quickly can they start breathing normally again?
So again, for asthmatics, we do breathing treatments right there. That should provide immediate relief. On top of that, you should do steroids for people who have asthma exacerbation. So the steroids, again, kick in within 1 hour, and so they should start noticing pretty significant relief. We can turn around asthmatics that mild reactions within a couple of hours in our ER. Obviously, the more severe it is, the longer. And then we have other options as nasal steroids for people who have severe congestion, nasal, same Benadryl family, anticholinergics that are very helpful, and those start affecting you fairly quickly, but within a day or two, you should definitely start noticing the significance.
And don't be afraid for allergies to head to the ER because they are, as you heard, they make it a spa treatment, warm blankets. That's going to get everybody in. And let's talk about the locations because there are 5 locations around the city, as you can see by the map there. So from Sugar Land, the Heights, Memorial, Montrose, and Stafford, and then you also have West Chase, which is opening next month?
Yes, next month is the anticipated opening date. Yeah.
Wonderful.
Well, and I understand you guys are giving free gift cards, so if people visit any one of the 5 locations during the month of April and they mention that they saw you guys here on Houston Life, they get a free gift card and a tour.
Yes.
So they can just stop in, like even if they're not like seeking treatment for allergies, they can just stop in.
Anytime, we're open 24/7.
And sometimes that's great because if an emergency happens, you're kind of familiar with the setting and you know where it is, so.
Courtney's familiar. She is.
I am. We've been there, and we recommend this all the time because you guys are wonderful. I didn't know about the warm blankets, though. I wonder if you've got to be 10. I'm just teasing. Trey, I hope you feel better. Keep those allergies at bay. Thanks for coming in.
Thank you.
Go Texans.
And Dr. Yusuf, thank you as well.
Thank you, guys.
Thanks so much. And for more information, be sure to check out ercare24.com and also check them out on Twitter at SignatureCareTX. Dr. Yusuf, thanks so much, and Trey.
I could really use a warm blanket right now.
I know.
Hey, coming up next, think age spots are permanent?